Any students came? I think if you are available, then you can say hi. Hi. Okay, hi Maleshwari. Hi. Only one student is there. I thought that at least you will join. And see, this is first time I'm taking live classes. So this is just a trial. I'm going to tell you about the introduction part of diuretics. Okay. Because this is first time. So I don't know actually how to do. But I wish that more students will join. Okay. Are you able to see the screen? My audio and voice, everything is good or not? Will say send any message, then it will be fine. I'll get to know that you are getting proper screen images and also the voice is clear. You can say the live messages also. Okay, hi, voice is clear. All right, if any other student is there to join, they can join. I kept it in that group also. Okay, hi everyone. So just I'm going to start the diuretics introduction. Okay, this is the common topic between B Farm and Farm D students also. Okay, so I'm just doing it for trial. Okay, next time if any holiday is there, I can take the online classes. Okay, so you guys could be at all whatever the time is suitable, you can tell me. Okay, so diuretics is there. Basically it is one of the chapter in both B Farm and Farm D. Okay, so what you know about diuretics? Diuretics are those drugs and agents which increases the excretion of urine by the kidney. Okay, basically what happened, these diuretics are given to remove the excessive salt and water from the body, and mostly they are given in the cardiovascular diseases, hypertension, as well as when there is a certain problems related with the kidney. Okay, so diuretics, if you want to write, you can write it also. Okay, diuretics are the drugs or the agent which increases the urine excretion by the kidney, and nephron is the main or functional unit which perform this function. Okay, diuretics mainly act on the nephron which is present in the kidney. Okay, so these are the drugs which help to remove the excessive salt and water from the body. Okay, mostly they are used to reduce the hypertension, as well as in case if there is a extra fluid retention in the body. Okay, in that case, either cardiovascular diseases like hypertension or some nephron problem, kidney problem is there, at that time we will use this. Okay, generally diuretics are given in the combination with other drug as it is required as per the diseases. Okay, so here what happen, if we give the diuretics, mainly it act on the nephron. Okay, so nephron, it is a functional unit of kidney. There are certain parts of nephron where a particular drug, many categories are there, thiazide derivatives are there, and potassium sparing diuretics are there, later on we will see about. But these drugs, they will help to excrete out or prevent the reabsorption of electrolyte. Suppose what happen, if normal process is whatever the ions is required in the body, they are reabsorbed and the remaining extra fluid will be excreted out. So when there is a patient, we have to remove the excessive salt to make the blood pressure low. Okay, in case of hypertension, water retention we have to reduce in case of body swelling or any kind of edema is there. Okay, so in that case what we will do, we'll give diuretics. So these diuretics, they will act in the nephron. Okay, so in nephron there is a certain parts, okay, where particular function is going on. So these diuretics, they will affect those functions. Okay, basically they will prevent the reabsorption of iron and the fluid in the nephron. So when there is a reabsorption, the fluid retention will be more. If the reabsorption is stopped, the fluid retention is stopped and it will excrete out through the urine. Okay, so that is why mainly these nephrons, the first basic concept is nephrons, due to diuretic effect, they prevent the reabsorption of drug. Okay, reabsorption of fluid and the salt in the body. So when this reabsorption is prevented, due to which the ions which are again our body is taking, it will go out. The fluid which our body is absorbing again, it will go out. Okay, so in this way it will try to control the hypertension as well as the kidney related problem. Okay, so here you can see, I will show you the image if I will turn the camera. Okay, so here huh? Wait, Advik, I am taking class. Okay. You can note down the definition. Here you can see diuretics are those drugs or agent which increases the excretion of urine by kidney. These are those drugs which help to remove the salt and water from the body, which make them very useful for the treatment of hypertension, other cardiovascular diseases, and in case of abnormal fluid retention, as well as they will help in renal disorders also. Renal disorder means the kidney function related problems. Okay, so mainly here you can see, this is the chart here. Body, in case if diuretics are not there, the body fluid, they will be reabsorbed in the body. Okay, some of them will be excrete out from the urine containing some of the waste and the fluid, whereas in case if we will take the diuretics, the excessive fluid will excrete out. Okay, the unwanted excessive fluid, and whatever is increasing the blood volume after taking the diuretics, they will excrete out from the body. So this is used for the treatment of hypertension in case if there is an increase in blood volume and the blood pressure. Okay, so it will reduces the workload overall on the kidney. So because of that, there is a some relief. So here I am talking about the nephron. Nephron is the functional unit of kidney. Okay, so here you can see different parts are there. This is Bowman capsule. Here the blood vessels will come in the Bowman capsule. Basically this is the place where the first phase of reabsorption takes place, because the blood will carry all the fluid from the body. So here in the Bowman capsule, the reabsorption process start. Okay, there is a exchange of fluids. Okay, afterward it is the proximal convoluted tubule. Here also certain type of diuretics drugs will work. The next part is here descending loop of Henle and ascending loop of Henle. Here you can see this is going down part, that is descending loop of Henle, and this is the ascending loop of Henle. Okay, and afterward this is the distal convoluted tubule, and this is the body part. Okay, this is the nephron part, which is very important, because if here at certain position like Bowman capsule, distal convoluted tubule, and this descending loop of Henle, if here the absorption takes place or fluid will enter, so what happens, they will be reabsorbed in the body. Okay, so that is the main thing. So if again these ions, they will go outside, they will reabsorb. Here you can see the excretion is done from here. So whatever the ions, they will enter inside, they will excrete out through the urine. Okay, so this is the nephron. Okay, right, are you able to see that diagram of nephron? If picture is clear, just say if picture is clear, then okay. All right, so here this is the nephron structure where the reabsorption takes place. In case if these ions, they will enter inside, then what happen, they will excrete out through the urine. So excretion through the urine. In case if here the absorption takes place, because there is a certain channels are there. Okay, later on we will discuss about what are the channels which are present. Okay, so here channels are there through which there is a exchange of ion takes place. Okay, at certain point, when there is a exchange of ion takes place at certain point, what happen, there is a some incoming of ion and some outgoing of ion through this channel. Okay, so because of that, whatever the ions they are coming outside, they will be absorbed in the cell. Whatever inside, they will excrete out through this. Okay, so the urine formation takes place, the urine, whatever the urine material is there, that will mix here. Basically the urine is formed in the liver. Okay, so here absorption, reabsorption will takes place. Urine formation does not takes place in the nephron, it takes place in the liver. That is the main thing. Okay, so here only in the nephron absorption and reabsorption of fluid and salt takes place. That is why it is very important. If the fluid retention and the ion retention in the nephron is more, it will increase the blood pressure and fluid absorption in the body. Okay, due to which what happen in case of kidney, you have seen, if a patient is diabetic, what happen generally, the body swelling is very common and the kidney failure is very common. All of us know that in case of diabetes mellitus or in case of diabetic patient, the kidney is the most affected. Why kidney is most affected? Because of this fluid concept only, the fluid retention and the fluid excretion. Okay, so overall in case of diabetic patient also, these are diuretics are sometimes prescribed in case if the patient has swelling in the body. It means that there is a fluid retention in the body. Okay, so all of you have note down this one. This is the diagram. If any doubt is there, you can just send me the message. Okay, in the message you can type. So here as you can see, the structural and the functional unit of kidney is the nephron, where actually urine, the real urine is formed in the liver. Along with this, kidney also play the important role in making the volume of the urine. Okay, so general introduction part you understood. Okay, so now next part I am going to explain is about this one, the components of nephron. Okay, as I told you, Bowman capsule is there, proximal convoluted tubule is there, loop of Henle is there, that is the ascending and the descending loop of Henle, and distal convoluted tubule is there. Okay, and last in the collecting duct where the urine will be collected. Okay, so here you can see Bowman capsule, it is a network of capillaries. Okay, because of that, when the blood will come from the arteries, okay, some components which come along with the blood, they will filter out in the Bowman capsule. So first important part is the Bowman capsule, where basically the absorption and the reabsorption process started. Okay, all the blood which is coming along with the ions and other materials as well as fluid, they are coming by the artery to the Bowman capsule. In the Bowman capsule, the arteries, they will supply the required fluid and ions by the glomerular filtration. I think you will study that in pharmaceutics also. Glomerular filtration is there. Okay, in that you will see that how the capillary action will takes place. Okay, I am not sure about that, but maybe capillary or osmosis process will be there for the absorption. Okay, the next part is the proximal convoluted tubule. As you can see, there is a PCT. Okay, proximal, I will show you in the diagram. Okay, here this is the proximal convoluted tubule. Here you can see one twist is there. Okay, so here also this is the important part, because here these mentioned part have certain channels. Okay, PCT, loop of Henle, distal. Okay, there are certain channels are present where the diuretics will act. Okay, so here the basically Bowman capsule, the capillaries are there used for the filtration purpose. Proximal convoluted tubule is used for glomerular filtration. Okay, so mostly what happen in PCD, there is a absorption which control the water, amino acid, glucose, sodium bicarbonate. Basically the fluid which is need to be the ions and the fluid which need to be retained in the body, here mostly decided by the proximal convoluted tubule. Okay, these tubules have the channel. Basically the absorption and excretion takes place in the body because these certain parts of nephron will have particular channel, and our diuretic drugs will act on this channel only. Okay, so here in the glomerular filtration, which contain mostly water, amino acid, glucose, sodium bicarbonates, as well as the electrolytes, okay, they will flow through the proximal convoluted tubule. Okay, now next is your, here in proximal convoluted tubule there is a absorption of amino acid, means 100% it will absorb. Okay, so whatever protein is there, glucose is there, it will reabsorb in the blood. See, I told you, if the reabsorption takes place, means the fluid and the ions, they will again enter into the body. They'll reabsorb. Okay, but in case if this channel is stopped, the reabsorption will blocked, and again they will collected and excrete out. Okay, next is the
explain about that.
Don't interrupt. Okay,
So that it will just
okay, so here in loop of Henle, the filtrate pass through the descending and the ascending limb. Okay, the descending part is permeable to the water and impermeable to the sodium. Okay, so here the water reabsorption takes place. So fluid retention will be maximum in the descending or the lower part of the loop of the Henle. Okay, whereas in ascending part it is permeable to the salt, so due to which the salt reabsorption is possible here in the ascending loop of Henle. Okay, so here it is written, it is impermeable to the water but permeable to the sodium ion, so due to which 25% of sodium can be reabsorbed through the sodium potassium co-transport channel. As I mentioned you, this is very important. So here you can see in the loop of Henle, the sodium and the potassium and the chloride channel is reabsorbed. Okay, so here due to this transporter channel, the reabsorption is possible here. Okay, next is here distal convoluted tubule. Here when the filtrate is passed through the distal convoluted tubule, it only contains 5 to 10% of sodium chloride. Again it is reabsorbed by the sodium. I am not audible. Now my voice is coming. Actually I muted due to some conversation in between. Okay, now I am audible or not? Okay, okay, fine, this will I will explain tomorrow again. Okay, distal convoluted tubule, when the filtrate is passed through the body. Okay, hi, okay, which is about 5 to 10% sodium chloride get reabsorbed. Okay, so this is sodium chloride co-transporter. Again here is one sodium potassium chloride channel is there, here sodium chloride channel is there. So what they will affect? They will affect the absorption of sodium ion and the chloride ion. If they will go,
this much. Okay.
if these ion, okay, if they go outside of the transporter, means they are reabsorbed, but in case if they will retain in the nephron, they will excrete out. So that is the main point. Mostly what happen, most of the students will get confused how the absorption and the reabsorption takes place. That is the main thing. Okay, how the reabsorption is prevented, how the absorption takes place. So remember, that is the main point. In case whatever ion is retained in the nephron, that will excrete out in kidney, and whatever goes outside from the nephron, that will absorb, or you can say reabsorb in the body. Okay, so if that point is clear, mechanism will be easily understood by you guys. If that is not clear, then mechanism will be very difficult to understand. Okay, because in mechanism the main thing is the channels, and you should understand, in case if inside the channel ions enter, means they are entering in the nephron, means they are going to excrete out. Okay, in case if they will enter into the nephron and they will retain in the nephron, means they will excrete out from the urine. But in case if they go outside from the nephron, okay, then it means the reabsorption is taking place, and because of reabsorption they will remain in the body. Okay, so up to here this concept is clear. What is the absorption, reabsorption, and how that ions they will excrete out, because in mechanism you will see the part of Henle channel is there, but if there is a prevention of absorption and reabsorption, what is the use? Most of the students are unable to think about it, or most of the students is unable to accept the concept that what is if it is absorbed or reabsorbed, or what happen if it is not absorbed. So that is the thing I am telling you again, repeating. In case if the ions will enter into the nephron, ultimately they are going in the excretion part, and in case if the ions they will go outside or from the this nephron or through the various channel, it means they are going to reabsorb. Okay, so that is the thing. Okay, so now this is just for the introduction part. Today I am going to stop this lecture up to here. It was actually a trial version, whether I will be able to connect with you, or you can tell me whether it is audible, visible, or whatever the problem is there. So I know some disturbance in between is there due to my son. Okay, so but it is just a trial. Next time onwards I will explain and take lecture on the board. Okay, so whatever good or bad review is there, you can tell me in the message. Okay, next time I will explain these all things on the board. This is just a trial, whether the network is okay and the voice is okay and screen is okay. Okay, so thank you Anusha for telling that. No problem ma'am, I'm okay. So in case I can take the online classes also whenever there is a possibility. Okay, I will repeat all this topic in class also, but what I need, at least in case if these kind of strikes is there, or maybe sometimes you will miss some kind of topic in the class, because here it is not possible to give attention to the 100 student at a time. So at least you can send me a message here that madam we want again this topic to explain. So whenever there is a holiday or something, I can explain at that point of time. Okay, so this is the best way which I feel that to communicate with the student and to sort out the problems. Okay, so thank you guys. Is everything okay? Then tomorrow I will again take the lecture, but it will be mainly I will take that lecture in early morning. Okay, so if possible you will woke up. Okay, and tell all your friends to join. Here I think only 10 members are there. I believe that if we had 100 student in B Farm and 30 students in Farm D, all of you should join. Okay, so whatever the doubt session are there, you can ask me. Just send me the message that madam we want this topic to be discussed. I can explain here also. Okay, so I want that your participation should be more. That will help me also and help you also. Okay, both the way. Okay, so thank you very much guys for coming live. Okay, and I wish all the support from you. Okay, so I'm going to disconnect it. Okay, good night everyone.
Good night. I want to hear it.